And you know why it's a great day? It is our last day of the summit, the 2022 summit. We are closing it today. And all sites, all tweets are on the Ciao Uganda Kampala Satellite One leg. Thank you for those who participated yesterday. We are going to go into a session, a short one, by our guest. And then after that session, we'll have our break tea. And then we'll go into the last two activities of the morning, which are priority setting and then the fishbowl group discussion. It will be very interesting. Keep your expectations high and the energies. So when we come to that moment, it's going to be wow. There is a team behind the scenes actually. So by the time we move out of this session, we'll be very, very ready. I want to request a team to help me with this one today. Just put it right here. You must be strong enough to carry it. But if you want to work out, it's also good for you to be helping us with this pulpit. Thank you very much. Are we ready? Are we ready to kick off? We look low. I'll be forced to challenge somebody. I think you now know that I can't, that I have some work. I have some work. When we take you, I'll show you. Remember that tune? You've just been doing it. Okay, without wasting time, I want to invite Dr. David back, and he'll welcome our guest. Yes, some applause for Dr. David. I hope you saw him during the nursery tunes.
Thank you, Ezekiel. It's Ezekiel who calls me those other things, but at Ciao, I'm only known by one name. Fahad, tell them my name. Musei, yes. So they call me Musei at Ciao. But he was translating. So thank you, Ezekiel, and thank you all. When you look at our program, yesterday in the morning, we had a slot for Uganda AIDS Commission to present to us about the contribution and role of communities and the civil society in Uganda. We all know these achievements we have made in the past have been because of the leadership and the support of Uganda AIDS Commission. So in our midst is the Director General of Uganda AIDS Commission. So he has delegated, once somebody delegates, then so he has delegated Dr. Danny Mukama to present on his behalf. And we are delighted Dr. Danny to have you in our midst. So this is a Pata Summit which for this year is running from Monday, and we are closing today. We are a total of 40 participants, including YAPs, health workers, partners like Baylor, TASO, Maldime Uganda, among others. The Ministry of Health have been here and they are about to come to join. So we have been moving together with the Ministry of Health. So when we get to you here, we are excited to advance the cause. We know the role that we play in the civil society and communities. But when we're in our villages, we may need to know at the national level what is our joint contribution, and we may be reminded of our roles as well. So we thought there would be no better person to update us on our roles and remind us of our responsibilities, but also tell us what have we contributed to the national targets and outcomes at this important summit. So at this point, I would like to invite Dr. Dan Byamukama to present to us. We may need to adjust our program slightly because he is busy, so he may not be able to fit in at a time other than now. So just appreciate that we have to accommodate him. So thank you so much. Can we welcome Dr. Byamukama?
Thank you, Muzei. Good morning, friends. Now, I didn't know I was coming to talk to the most vibrant age groups, but nevertheless, I am pleased to be here. I will adjust my conversation to take care of the young people who have the most energy. So my discussion is about the role and contribution of communities and civil society in pediatric and adolescent HIV programming in Uganda. And I'll try to be fast. In Uganda, they already introduced me. I'm called Dr. Dan Byamukama. I work with the Uganda AIDS Commission as the head HIV prevention. So I have met several of you in various other capacities. But today I am representing the Director General who was invited for this meeting. We implement a multi-sectoral HIV response. I hope you all know that. Multi-sectoral HIV response means that we discovered long ago that HIV is not just a medical problem. Everybody has a role to play. Young people, old people, religious institutions, cultural institutions, civil society, everybody. So every sector of society has a role. Civil society has been part of the national HIV response from the very beginning of the epidemic. And in many instances, civil society has been moving ahead of government initiatives. You should clap for yourselves from civil society. We acknowledge that some of the elements of the response were engineered by civil society. I can give you an example. When the government started HIV testing programs, PMTCT programs, PMTCT was like a police case. The testing had to be done by a midwife. The prophylaxis had to be given by a consultant doctor or something. But civil society organizations experimented with Ray Cancer. You know the Ray Cancer now who tests for HIV? It was civil society who demonstrated that actually you don't need a midwife to test a pregnant mother for HIV. Now, once they piloted and proved that the Ray Cancer can do HIV testing, the government was able, you can't hear me properly, the government was able to bring the Ray Cancer offer the services. Otherwise, the government was like, no, these are delicate things. Only doctors and senior midwives can offer PMTCT. So civil society has been pulling government really to move at a fast pace. Notably, civil society has played a critical role in HIV/AIDS advocacy and service delivery. If it was not for civil society, even the ARVs would not be in Uganda by now. Because of civil society advocacy, you know, civil society, for you, you can say things I cannot say. Me, I'm from government. If I said them, I would be in trouble. You can address and come with your placards and shut down the meeting. I cannot do that from government. And it's through such advocacy, even done outside Uganda, so we're able to have antiretroviral drugs in Uganda and sub-Saharan Africa. Over the years, civil society has also helped in guiding HIV and AIDS research. These days, yesterday I was presiding over a meeting by UNESCO, Uganda Network of AIDS Sex Workers. They had implemented first-class research. I said we must publish this. So civil society and communities are at the forefront of HIV research in Uganda, and we applaud you for that contribution. So without civil society, fewer services would be available to vulnerable population groups. You advocate for vulnerable population groups. You have innovated models of service delivery that make it possible to reach such vulnerable groups, including groups of people who are far from really the main road, the hard to reach areas. If it were not for civil society, certain communities would be left behind. So we are proud of you. We thank you, civil society, and we thank you. We know you spend your sleepless nights writing proposals back and forth, and you bring resources for the HIV response. And for that matter, we are proud. We appreciate your sweat and your effort and your contribution to the national response. The national framework recognizes the position of civil society, starting with the National Development Plan. The National Development Plan is the overarching programming framework for the country. Development framework. It recognizes that civil society is a key partner and actor in the national development. Some of the frameworks that operationalize the National Development Plan, one key framework, the National HIV and AIDS Strategic Plan. What I have said, the National Strategic Plan recognizes that civil society, and it articulates your expected contribution. It recognizes your contribution, your meaningful contribution, and it shows where we count on you in the national HIV response. There are some elements of the response which are best suited to be delivered by civil society organizations. The National Strategic Plan, for example, it highlights that civil society participation in the national response to HIV is being dual track. You are key as service providers and as consumers, and as I said, now in research. Some of the expectations are these were articulated in the National Strategic Plan. It says, participate in the processes of establishing and reviewing HIV and AIDS policies. So we can no longer develop any policy in Uganda now without civil society stakeholders on the table, because you are really a key stakeholder and a key partner. We expect you to conduct evidence-informed advocacy. We are counting on you for advocacy. And as I make my presentation, as we aim to end HIV among adolescents and children, we shall show you areas of advocacy where we think civil society efforts in programming and advocacy and research can be channeled for us to attain our goal of ending AIDS as a public health threat by 2030. We expect you to strengthen collaboration and networking for effective linkages with other actors in the public and private sectors. We expect you to collaborate with stakeholders to conduct social mobilization for improved service delivery. Social mobilization, still very key. We expect you to complement government in the implementation of the National Strategic Plan, to encourage self-regulation among members of civil society, to perform regular reporting. Now that is a key, and it's a gap. We expect the regular reporting, both financial and service delivery and programs. But we are still having a challenge, as I will show you, and as we make real recommendation. The overall national HIV response is guided by the presidential fast-track initiative to end AIDS as a public health threat by 2030. That commitment was the head of state on the 6th of June 2017. You can see him there signing a commitment that we shall end AIDS. And now signing this commitment, you know the gentleman with the specs looking at you? How many of you know that man? How many of you know the gentleman? He's called Michel Sidibe. Did you ever hear of Michel Sidibe? Michel Sidibe was the former Director General of the UNAIDS. The whole president of HIV response in the world traveled to see the president sign a commitment that Uganda will end AIDS by 2030. Standing behind the president is the former country director for UNAIDS in Uganda. And the rest of us were somewhere in the picture behind there. The president's initiative was an evidence-based initiative. And some of the commitments based on what he had studied and believed, elements like prevention of mother-child transmission. He believed that by 2020, Uganda should not have any reason to see any more children born with HIV. Fortunately, some districts have actually attained that. And some districts where you come from have failed to attain that. So as civil society, what can you do? If some districts, you remember the other joke? If some districts can did it, how come your district has not did it? You remember that joke? So if some districts have attained zero mother-to-child transmission, how come your district has not yet done that? And there is a job for civil society there. Why doesn't your district do it also? So the president's initiative summarizes 5 focus areas. Number 1, engagement in HIV prevention. Everybody who stands up to talk will tell you new HIV infections are amongst young women. I hope you know that song. That the highest new HIV infections are among adolescent girls and young women. But where do they get those infections from? From men. You agree? We have done research which was published at the JAR like 2 weeks ago, which showed that actually most of the women who got HIV infection, they get it from men in a certain age group. How many of you men are between the age of 25 and 35 years? 25, 35? These are the greatest spreaders of HIV in Uganda. Have you heard me? The women who are here, have you heard that? The men between the age of 25 and 35 are responsible for the spread of HIV among adolescent girls, among old women. Even women who are 50 years old who are contracting HIV, they're getting from these men, 25, 35. So as we aim to end HIV among adolescents, among children, ending HIV among children means ending HIV among their mothers. Are we just going to focus on the children and their mothers when we know where these women are getting the HIV from? So as we think PMTCT, as we think adolescents, think about the source. We cannot deal with adolescents alone now. But who is giving HIV to adolescents, adolescent girls? It is the men between the age of 25 and 35 years. Who is giving HIV to their mothers? It is men between 25 and 35 years. Who is giving it to their grandmothers? It is men between the age of 25 and 35 years old. So as you think programming, think engaging the man, especially the man between 25 and 35 years old. And that's what the president is saying. We cannot end HIV among adolescent girls and young women without engaging men. Now, you have work to do. As champions of advocacy in the HIV response, can you address that young man, 25, 35 years old, who is really injecting the old women and young women and even transmitting HIV? Accelerate implementation of test and treat. I will show you there that we have made progress, so much progress among children, but also we have not made progress in treatment. I mean, consolidate progress on elimination of mother-to-child transmission of HIV. That is your key concern. We have stagnated for quite long, but we need to double our efforts to make sure we end mother-to-child, because the president believed they would do that by 2020. We are talking financial sustainability for the HIV response, and part of my discussion will highlight what you need to do to make sure we are talking about financial sustainability for the contribution civil society makes. We are talking about the final pillar of the Presidential Fast Track Initiative is institutional effectiveness for a well-coordinated. We are talking about coordination. And I will highlight as I conclude some of the, okay. You are familiar with this graph. You agree? It shows that the highest HIV infections are between 15 and 24, 29, but you can also 0 to 14 there. Those are newborn babies. So MTCT, mother-to-child transmission, is a significant contributor of new HIV infections. But we see girls, adolescent girls, between the age of 15 and young women up to the age of 29, they are also a significant contributor of new HIV infections. I have told you, young men between the age of 25 and 35 are responsible for what is happening there, where I have circled. So as we address These are the new HIV infections we had last year, 54,000. Of those, 6,000 were children. Men above 15 years were 16,000, but you can see women are disproportionately affected, 31. But I tell you, the very few men who are there are responsible for what is happening to women there. I also want to highlight, I wish you could see this, but I'll share with you this, that there is a big problem in certain districts. We may have 146 districts and cities, but only 31 account for more than 60% of all HIV infections. So there are districts where the problem is so disproportionate. As a civil society representative from those districts, what can you contribute? What are you going to do? Civil society, you are masters of innovation. What are you going to innovate? What are you going to do to challenge your district, if it's among those 30, to make sure it does not continue to lag behind? Here, this graph, I wanted to show you one of the key contributing factors of HIV transmission, both to pregnant women and to young adolescents, is the community viremia, the prevalence and suppressed viral loads within the community. If you're from the mid-north region, the Rango Acholi region, you are winning in not suppressing. So that means if you're from civil society, you must lead innovation and advocacy and even programming to support individuals from that region to make sure they attain viral suppression, like our friends in Karamoja and West Nile. The viral community viral load in Karamoja and West Nile is sorrow. That's why even the prevalence is sorrow. So you can see from that map, the Rango Acholi region is so red. The other region that has high community viral loads. So when there are so many when the viral load in the community is so high, the chance of transmission within that community is high. So as civil society leaders in innovating to make sure you support viral suppressions in this community, starting with the Rango region, Acholi region, the Busoga Bukwedi, that region, and of course all the others, but those key. If you're from that region, you have some advocacy work and some innovation to do as civil society. This graph, I intended to show you that actually what I said, that men are the transmitters, and this same graph also shows which age groups. This is a summary of what I already said, that men between 25 and 35 years old are responsible for all the HIV infections. The other groups you're going to deal with are the migrants. Many young people are so mobile. We see that mobility is a high risk of acquiring HIV infection. So as you innovate to end HIV among children, you start by ending HIV among the mothers of the children. Isn't it true? So we have seen that most mothers of reproductive age, between the age of 18 and 25, they are so mobile. So as young people, as young innovators, how are you going to meet the needs? Whenever you see a young woman in your community, you see somebody who is at increased risk of acquiring HIV. If you want to prevent mother-child transmission, you start by, which prong is that? Prevention of HIV, primary prevention of HIV among women of reproductive age. Which prong is that among the 4 prongs of PMTCT? Is it prong 1 or prong 2? But I think you understand what I'm talking about. The prongs, the 4 prongs of PMTCT, you remember them? So, as you innovate as young people, as you innovate as the civil society, find innovations for meeting the HIV prevention needs for mobile young people. Most young people are looking for jobs. You can only get a job for 6 months and you must move to another job. That increases your vulnerability. What are you going to do for us to make sure the young person who must move in search of jobs is supported and her prevention needs are met? Treatment. Second pillar of PFTI is on HIV treatment. Here I want to emphasize, number 1, that we are doing badly on HIV testing. Initially we thought we had attained the first 90, but we have not yet. we're at 81%, which means 19% of all people living with HIV are not aware. That means they will continue transmitting to their wives. So what are you going to do as civil society, as organizations of young people, to promote HIV testing? Now, it may be at 81%, that is because there are so many women who are tested. But if we disaggregate by young women or young men and children, the parameter is worse. So what are you going to do as civil society to contribute to our goal of ending AIDS by 2030 by promoting HIV testing, which is one of the areas where we are lagging behind terribly, and worse among children and adolescents and young people. This graph is supposed to show you who is lagging behind. So where, for example, my sister, where do you come from? Kachika. Ruchiga. Ruchiga is southwestern Uganda. You are not as bad as mid-eastern. Who is coming from Busoga? Here. Busoga? Yeah, you keep your hand down because the things are so bad here. It's okay? So who is coming from north of Uganda? North of Uganda is Ruwero, those areas of Nakaseke. Who is from Nakaseke, that region? Yeah, keep it down. Because, so this graph is supposed to show you as civil society, as masters of innovation, who try out the new things. Government is used to doing the same thing. If you look at government planning, they use the same template they used in 1979. The new things that come up are things that have been created by civil society. When you see a government work plan change, it is because civil society innovated something and it worked. That's when they managed to smuggle it in. Otherwise, they use the same template since 1960. The same template they're using now. So as leaders of innovation, you have to do something. If you're from Busoga, please go and help us to mobilize your people to test. Create new ways of encouraging both men and women and young people to test. And then you'll see how the district local government work plan will change based on what you have discovered. If you don't discover anything, the district work plan will stay the same as it was in 1989. So please help us promote HIV testing. This is about mother-to-child transmission. We are still at 2.7%, which is much better than it was several years ago, but we want zero, because in some districts there is zero. The challenge with mother-to-child transmission, I'm very sure somebody has discussed this with you, is number one, the major contributors are women who start antiretroviral therapy. They test, they are pregnant, they are told they are HIV positive, initiate on antiretroviral therapy, and they drop off. I tell you, the district local government officer will not solve that problem. Civil society, you will solve that problem. And then the district local government officer will adjust his work plan and copy what you will have invented as civil society. So how are you going to help us sort the problem of women who drop off antiretroviral therapy while they are still pregnant? They contribute disproportionately. The other group that contributes disproportionately to mother-to-child transmission are women who drop off antiretroviral therapy while they are breastfeeding. I assure you, the DHO will not solve that problem. Civil society will solve that problem, and the DHO will update his work plan according based on your findings and your innovation. Can you help us? Tell us, why do women drop off ART while breastfeeding? What can we do to help with such women? Once you have discovered, we shall adopt. The other key area is women who acquire HIV during pregnancy or during breastfeeding. All through antenatal, they were HIV negative, but during breastfeeding, they get infected. And you can see they contribute the biggest chunk, women who get infected during breastfeeding. As civil society, how are you going to help us solve that puzzle? I have already made a confession that the district health office will not solve that one. They rely on a standard work template that was generated in 2000. It is the same thing they keep recycling. If you do it well and we run, the district adapts. This shows you that a significant number of women who come for antenatal are tested, and a significant number are initiated on treatment, but viral load suppression is not really the best. They don't attain good viral load suppression. So, how are you going to help us in innovating on supporting pregnant women, all of them attain viral load suppression? Here, I wanted to show you spending. Finances have an implication. But you can see where PrEP. So the various prevention pillars, PMTCT, you can see where it falls. It is much lower than how much we spend on circumcision. Have you seen? Those of you are not colorblind like me. Circumcision takes a very disproportionate chunk. So as advocates, civil society, you are champions of advocacy. How are you going to advocate for reasonable funding for the programs that you support, including PMTCT, including programs for adolescent girls and young women? Look at the program for adolescent girls and young women. Can you see it? It's at the bottom. You see it? Adolescent girls, we are saying adolescent girls have the bulk of the problem of new HIV infections. But you see what is allocated to them. So as civil society, as masters of advocacy, how are you going to use this information? Remember, you can say what I cannot say. I only create a platform for you to say it. And may I keep quiet and I clap for you from under the table. Thank you for saying it. So you can see, so the allocation of resources may not be according to new HIV infections. Civil society, your work is to advocate for the changes that are reasonable, which I may fear to say. So this is still the other table summarized. So I want to conclude by summarizing that we appreciate the work civil society has been doing, your contribution to the national HIV response. We appreciate that you look out your donors, your own friends, and spend sleepless nights writing proposals and reports and securing funds as the independent individuals to contribute to the national HIV response. We appreciate that you have been leaders in innovation. And as I confessed, some of the programs we implement that have been successful, it is because civil society first innovated. And I have given you several examples. And we still count on you to lead in innovation, challenging the status quo, so that we don't default on our commitment and AIDS as a public health threat by 2030. We appreciate your advocacy, but in my presentation, I have shown you where we still need your advocacy to ensure that we don't default on our commitment by 2030. We appreciate your effort in service delivery. I hope in my presentation, I have shown you if we have to end HIV among children and adolescents, where you're going to focus your service delivery. We appreciate your increasing contribution in research. You must have seen where you need to answer questions by doing credible research and targeting your efforts. We appreciate those of you who are cooperating with coordination. Many of you find that a challenge, but we want a well-coordinated response. So endeavor, whenever you are implementing, just to know the area under which you fall. Are you contributing through the education sector? Make sure your work is known to the education sector, whether at the decentralized level or at the national level through the Ministry of Education, and submit your reports. Accountability. We want to know the resources. We don't want to take away the resources that you raise for yourselves. You raise through your efforts, but if you help us know, we shall articulate, we shall be able to coordinate. So if we know there are so many partners in Wakiso district with this amount of money, if we got another partner trying to do work in Wakiso, we shall say, no. A fair distribution of resources here. Why don't you go to Mwende instead? But because we don't get information from you, and it's very difficult, even when we try to do the national spending assessment, the NASA, it's very difficult for civil society to give us this information, which we need not for policing, but for planning. As I said, if we are aware that there is $2 million in Wakiso, but there's only $500,000 in Mbarara, the next partner who wants to go to Wakiso shall say, no, go to Mbarara for equity. So cooperate with us in sharing us with us reports. Fortunately, there is a system which I want to let you know. Parliament has passed a new law that requires civil society to give this information to Uganda AIDS Commission. So every year you'll be reapplying for your certificate of operation. You reapply, you give us all the reports for the whole year. You give us your accountability for the whole year. And then we shall issue a certificate to continue operating. We have tried to beg you to cooperate, but you have failed. So we have put a noose somewhere. If you fail to account, you fail to apply for the registration, then your organization, you'll see people coming and closing it. They didn't have to go that far. Whatever we do at Uganda Aid Commission is for the good of the response. We cannot do anything to distress you or harm you. We want to double our efforts. If we continue doing work at the pace at which we have been working, we are going to default on our commitment and AIDS by 2030, but it's achievable. So let's double our efforts. So if you've been submitting 10 proposals a year, please submit 25. Doesn't, it's okay. We shall appreciate, and God also appreciates. We are looking at sustaining financing for the future. So when we talk about sustainability, the question is, how shall we sustain the functionality of civil society? You play a key role that no public sector can play. So civil society is here forever. Civil society will be needed forever. You shouldn't feel threatened. So, but we are looking at advocating for social contracting. Now that the government of Uganda has discovered oil, they are about to become rich. Can the government of Uganda start allocating a certain predictable amount of money to support civil society organizations to do the work that they inevitably do on their behalf, and it is recognized that they are best suited to do that work? That is called social contracting. That is an area I leave you as a challenge. Prepare to advocate for that. That as the first oil comes out and the cake is being cut, then they slice out the cake for what? Civil society social contracting, to give you the money, to play the role, you play to support government efforts, that is recognized, that is only civil society best suited to do. So social contracting, as part of your advocacy, start now advocating for social contracting. By the time the oil comes out, the debate will have really sunk down. The decision will have been made. You'll get your cake, and your response and contribution will be sustainable. Because as soon as we get the first oil, I'm very sure many donors will drop, including the donors that support you. So how shall you sustain? Social contracting. Social contracting, do your research, use your platform, start talking to government social contracting. And by the time the oil comes, I guarantee we shall have this avenue available to sustain your work. I thank you for listening to me.
Thank you, DG Dan and the Uganda Aid Commission. I would just kindly ask Ruta to lead us into appreciating the Uganda Aid Commission appropriately.
The mic ebadde teriiko. Anyway, it's my first time being up here, by the way. Here. Hey. Okay, this is what we are going to do, yeah? You have heard of the Paraganja club, right? Yeah? Hey, so I'm going to lead you into this club. We are tired of having a disorganized club. And you see people driving those expensive cars, Range Rover, Tebaisa. It's always people who are driving Wishi, Monobuhari, Obuwara. So this is what we're going to do, yeah? I was showing you what to do. Now we are going to do it.
Thank you, Ruta. So thank you so much, Dr. Dan. We appreciate the Director General. I don't think there would have been anybody who would have delivered this better than you. So thank you so much. And we thank you, Uganda AIDS Commission. I picked a few things from the presentation. One is that if the Uganda AIDS Commission, if the Director General of Uganda AIDS Commission, if Dr. Dan can appreciate our relevance, our effort, and our contribution, I think that is something we should be proud of. And when we go back, we should pass this message to our colleagues so that it motivates them. It's different if you are doing a lot of work, but nobody knows that you exist and you are doing the contribution. So that is something I've noticed from here. The other one is that they talk like Uganda AIDS Commission with the facts, figures, proportions, percentages, and the like. So this is when we go back, we are going to base on this to know that to know where we are. We have contributed fine, but where are we now, and what can we do more and better, based on the figures and the facts that he has presented. So we still have a long way to go if we are to defeat AIDS by 2030. I wish Dr. Dan would stay longer with us, because the next activity we would greatly benefit from his input when we are setting our priorities for the next coming years and time. However, we would take this opportunity. If you have anything you want to communicate to Uganda AIDS Commission and be done before we go to the next session, you would probably allow a few people to, if they have any questions or things to say, and then we continue. So it's time to, either if you have a question, if you have any area where you need clarification, any input. Okay, so there is 1, 2. Any gentleman? These are 2 ladies. So for anybody who identifies himself as a gentleman, okay. Let's start here. Yep.
Good morning, everyone. My name is Esther Kawashimango, and I would like to ask Dr. Dan, where do we find that research you made to conclude that men between 25 and 35 years of age are the biggest spreaders or transmitters of HIV/AIDS? Thank you.
Thank you so much. Thank you, Dr. Dan, for your presentation. My name is Jovia Mirembe, and we appreciate the work that Uganda AIDS Commission is doing in ensuring ending AIDS by 2030. And I also appreciate the President for having made a commitment to us to end HIV by 2030. However, to me, I feel the President is forgetting this commitment, for lack of a better word. One, yes, we appreciate that systems are better now. Antiretrovirals are here. Like we said, CSO played a very important role in bringing ARVs to the country. And now we got challenges. With COVID and Ebola coming in, and the situation in Karamoja, it is no longer just about the ARVs. It is about other things that are going to help these mothers who are getting pregnant, who are getting off ARVs during pregnancy and breastfeeding. The causes could be that, yes, the ARVs are there, but there is no food for them to eat to take these medicines. Also, the women who are getting HIV while pregnant, this could also be, I am assuming, they could also fall in the category of sex workers, because still we don't have food. COVID did made a lot of disadvantages for us. People are lacking food. Now Ebola has come up, Movende and Kasanda are under lockdown. How are these people being helped to access food? Because now they are not able to work. Also, the Karamoja situation, we saw recently people living with HIV dropping dead because of food. And Dr. Dan, you as government, yes, civil society has written proposals to help this, but what is your role? What have you done? Maybe what could you do more to ensure that all these things are really made? Because the Karamoja situation is just a matter of taking food to them, it's not just only medicines. But other than that, we really, really appreciate your efforts and thank you so much.
Okay, thank you. Can we have one more from somebody who identifies himself as a man, if there is any? Okay, thank you. So,
Okay, I'm sorry I have to leave, but no, you have so many experts here. I know you have always done this work by yourself. So you are most of your experts. I know you'll come up with a good action plan. Kabashambo's question. Now, this research was done by the Rakai Health Sciences program. There is a research, a cohort, where a researcher studies the whole community, a complete community in the Rakai region, like 9 districts. So they keep on studying the behaviors and the impact of certain programs we implement. So they have done a study that is so credible that was shared at the JAR to show that the master spreader to both the young women and the grown women is the young man between the age of 35 and 35. So when you're programming, I insist, this research was done in Uganda. Plan for the young man, 25, 35. No more planning for the girl alone. Jovia, you raised a very important question. Government is making efforts to ensure they take food, supplements, and support Karamoja. Me and you know there are food supplements in some hospitals. The RAT, the ready-to-eat foods. But government's efforts are scattered. They are so thin because of resources, but it's through continued advocacy. Government responds to where there is pressure. Through continued advocacy, I promise myself I will add my voice to yours to make sure if this food has not reached, I have seen commitments that they will deliver food supplements to some of these disadvantaged districts, especially the Karamoja region. If it has not reached, let's continue advocacy together to make sure we insert enough pressure. Government responds to pressure, and this food will be delivered. But we're a poor country, so nothing is done to perfection. Nothing is done to perfection. If they started the parish development model, and eventually there was no money for paying salaries. You've seen these things in the newspapers. Parish development model, they have put all the money to parish development models. Eventually, there's no money for certain programs. So that's a problem. We shall have to put pressure to get food to Karamoja and other related regions, but to be sure you will see another hole being dug somewhere. So it is only after we have put enough pressure to make it a priority that they will really say, okay, what do we put on hold? It is because we are still a poor country, the resources are not yet enough. But the will to really address certain needs, I must commit it honestly there. Pressure, more pressure. Thank you. You have to let me go. I thank you for inviting me. I look forward to sitting with you in the room again. Thank you.
yeah, thank you for those questions. They were really valid, and it's good we have got some responses. So we thank you, Dr. Dan. But I would do, before you go, I would do, since Emma has come, if you could share with us just a cup of tea. The good thing, the cups here are small, so they won't take you long. Then after that, we could meet you in another forum. So I would like to Ezekiel. Welfare. Huh? Welfare.
Yeah, thank you so very much. I want to add my voice and appreciate the Director General for coming and for flashing our performance. I hope you saw your region and you must leave here motivated to go and do something to contribute, especially where we have the red lines. It's time for our break. But I also want to remind you that we are already behind time. So our break is going to be 20 minutes. So you catch a cup of tea and then we quickly run. If 20 minutes elapse, then it will become a working tea. And then we know that the team going very far after lunch, I think will give you liberty to live at leisure. So we are working out to see everything you need sorted between now and lunch. If you have any questions, please feel free to contact me. Contact Vivian or the team. There is Emmanuel, there is Isaac or Fahad. They will be able to sort us out. I hand over to welfare. Welfare. Remember, we are going to do the priority setting and then the fishbowl discussion. So let's do the tea very fast.
Good morning. Our break tea is ready. And your sausages are there today. Let's have a prayer from this beautiful lady.
Good morning. Let's humble ourselves for our word of prayer. May the Creator bless our breakfast. Amen.
Okay, let's line up.